So, one of the situations that we're going to talk about, might sound something like this. Mom or dad has fallen and they can't come home. So, we can't afford, maybe a long-term care facility that has, private care, has their own private room. But we can't care for them at home ourselves either. So, we're limited, whether physically or, geographically, whatever those look like. So, now what?
It's a lot harder when you don't know your options.
Okay.
Even speaking to somebody who can offer you options and resources, that is what a social worker and a case manager will do. They work in tandem and they will look over your insurance plan if you have one. They will look over what your insurance will accept, where the best place for this patient to end up might be based off of their medical condition upon discharge, and contributing factors to the impaired ability to participate in independent activities of daily living are usually what ends up getting people to this point where they need more help. It's more than just a broken bone or a hip that needs healing. If it were just that, they could go home, but we're talking about more than that. And so that's when your resources are going to be everything, and understanding that you do have a choice in the matter and you don't have to make it blindly.
I think that's helpful. Yeah, even those two situations where it's just something you fall in, so there's a bone that's broken and it needs to heal, versus, some of these independent living activities, like the activities of daily living. So I guess in this situation, someone's fallen, we know they can't come home. What kind of happens immediately? So someone's fallen, they're kind of taken to the emergency room. Walk us through kind of the immediate steps that you see.
Yeah, so likely either a family member or what we call EMS or emergency medical services, 911, will take them to the emergency room. They'll go through triage, likely an admission into the hospital. That's when your stay looks like more than just an examination and an x-ray taken from a broken bone, a splint, and they send you home, but you're now actually getting admitted. And they'll do the classic lab draws and run their tests and tell you that you'll stay X number of days. So we try to get that physical therapy on as soon as possible so that they can keep up their highest level of activity. It's quite surprising how quickly people can deteriorate if they are sitting in bed and not moving. Some might think that's a good way for them to rest and heal up, but the fact of the matter is it's very healthy for our body to continue to move at our highest level of functionality. So discharge planning as well, it ought to be started beginning day one at the hospital, and it ensures proper setup of the patient needs and any helpful resources.
Kind of right in line with that, what do you feel like people need to be prepared to decide or, be thinking about after that?
You know what? I think that one of the biggest things that I try to convey to patients and families is that this patient may never return to their baseline that they had upon walking into the hospital or they had before that fall. They might have a new normal. It might look totally different. I hear a lot of families talking about their grandma or their mom who was just out swing dancing last week and she was totally fine. It's just a fall. And that fall really changed a lot for this grandma. And they are not going to get back to swing dancing. And that's really difficult to adjust those expectations. But I think that's something that people need to be prepared for, is the adjustment of expectations. And what are the limits of medical care during a hospital stay? People need to be prepared to decide what the limits are for themselves if they're the patient, or if they are and we'll talk more about this, but if they're the healthcare power of attorney and they have the say, or if they're the surrogate, what is the patient's quality of life? Because only the patient can decide this unless they're physically or mentally unable to voice it and there are no documents written up prior. So be prepared to decide what is the patient's quality of life. What are the limits of care? In the event of an emergency, respiratory failure or cardiac arrest, does the patient wish to be intubated, or also known as placed on life support with the breathing tube? In the event of cardiac arrest, does the patient desire resuscitation with chest compressions and medications? If it's cardiac arrest, they'll also be likely intubated and put on life support. And so, are we allowed to do those things? Is this what the patient would want? Or are they at an age or a place in life where they say, if something really goes wrong, I've lived my life and I'm comfortable with that being the end?
So I know we tell clients all the time, have documents in place, know and decide who it is that you want to make these decisions for you. So mom or dad is in the hospital, they have this healthcare power of attorney in place, so they have a document that's been drafted. As a medical professional, what is it that you're looking for even as you start kind of working with this patient?
Standard operating procedure is that when somebody comes in, especially if we know right off the bat that they're just elderly and they are looking very frail, does this person have any kind of advance directive? Do they have any paperwork that tells us that we are not to resuscitate this patient? Because that's illegal. If we put our hands on them when they have paperwork that says do not resuscitate me, that's some legal trouble, and they might be pretty upset if they wake up. So we need to know who's the next of kin or who is legally in charge of this patient, who is the healthcare power of attorney. The healthcare power of attorney might not be the next of kin. Sometimes there's a language barrier. Sometimes the next of kin maybe is not in their right mind enough to be able to make the decisions. It might be a daughter instead of a husband. And we can talk about the roles of those powers of attorney, but especially it's important for the doctors to know who is the next of kin or who is the one making decisions for this patient if the patient is unable. I want to say, as a rule, the patient is making the decisions for themselves. And it does not matter what the doctors think is the best thing to do. It does not matter what the sister thinks is the best thing to do. What matters is what the patient wants, as long as that patient is deemed fit to make decisions. If the patient is deemed unfit or disoriented, that's when you start to get into finding who might be able to step in and make decisions for them.
I think that's just like a good reminder to people that if you do have these things in place, they do actually get used. So I guess in kind of as we progress through the situation, what do you feel like people need before they leave? Kind of what are the things before you leave the hospital? This is what you need to have in place.
For the patients and for the families, speak with case managers and social workers. It's in the right of the patient and or the healthcare power of attorney to ask for a consult to a social worker. Palliative care is, I think that they are such a hidden gem. And I wish they weren't so hidden. But this is a consult that I would highly encourage people to speak to before leaving the hospital to clarify quality of life, because palliative care is going to specialize in symptom management. So no matter what you have, you let palliative care know what your best quality of life looks like. And if you never want to be placed on a breathing machine, you can write that down and you can make sure that that never happens to you. If you want the best pain medication there is, even if it knocks you out, then they can put that on paper for you. So ask about that. Know what resources are available for continuity of care. Here we're talking about either medical care, whether it's rehab or it's physical therapy outside of the hospital, or custodial care. That's different. Does grandma just need a friend to sit with her while she's home and help her get dressed and make her some food? That's more of custodial care. It's really helpful for people to get an up-to-date medication list because it'll be necessary at their next hospital visit. And education regarding new or ongoing medical diagnoses, that should be mandatory. Not every care provider that you come across will take the time to educate and to answer questions. It is your right to have your questions answered. So get the education for that diagnosis.
So I guess, okay, once they leave the hospital, this is where we kind of start thinking about this. Like, what are the options that you see for where people can go? What does that normally look like? Kind of what are the choices?